do you intend to bring your personal viewpoints into your job as an administrator at the Ohio Department of Health?
The next chief of Ohio's health agency will likely be an abortion opponent who is not a doctor. Good evening, everyone. For abortion opponents, it's a potential victory. For abortion rights advocates, a potential defeat.
As Jeff Hirsh reports, there's another issue surrounding the man who will likely supervise health in the state of 11 million people. Does it matter if he's not a doctor? Jeff's live in the newsroom for us.
Well, good evening. Richard Hodges is Governor John Kasich's pick to head the state health department. Some of the state senators who will vote on Hodges questioned him today in Columbus. Ohio law says the state health, well, you know what? Folks, we're going to start all over again. There's a mistake. Let's try this again, okay? State law says the health director must either be a doctor or have significant experience in public health. But the term significant experience is not defined. For some legislators, there was a critical question.
Whether or not you would take your personal viewpoints on certain issues pertaining to women's health and choice into your role as the director of the Department of Health.
And for some critics, there was another question, too, whether the director of the Ohio Turnpike Commission...
And Mr. Hodges does not have a medical degree. He's very clear on that.
I am not a medical doctor.
Whether a non-doctor can head the state agency responsible for the health of 11 million Ohioans.
He stated to the testimony today that he is not a scientist.
I've held management and senior leadership positions in both the public and private sectors for more than 27 years and was responsible for addressing healthcare issues in many of those positions.
Hodges is a former state legislator and did have some management positions at small hospitals in the 1990s. To some that's enough, to others no. But there's another issue too. There were three words which were never mentioned in this hearing. Never mentioned. The three words abortion and Planned Parenthood. But while those three words were never specifically said, they were there under the surface. That's because as acting health director, which Hodges is right now, he cited the Cincinnati Planned Parenthood Clinic for not having a recently state-mandated hospital transfer agreement. Not having that emergency agreement could force the Mount Auburn facility to close.
The closure of those kinds of clinics would be devastating. And it's not just family planning. These are services that are part of the primary health care system in the state of Ohio.
I think the General Assembly has been very clear about what its policy is. This is a childbirth, pro-childbirth state. We have been against taxpayer funding for abortion and are for the proper medical care of women who are seeking it.
Now, back to the issue of significant medical experience. Hodges did have management experience at two hospitals in small northwest Ohio counties in the 1990s. Those counties have 80,000 people combined, or about 10% of the population of Hamilton County. He was also on the Health and Retirement Committee while on the legislature in the 90s as well. Critics say that is nowhere near enough, but Hodges' supporters say the director's position is primarily a management post, and they say the federal Secretary of Health and Human Services, the Washington job equivalent, is not a doctor either. The Ohio Senate Health Committee today recommended Hodges' approval. The full Senate is expected to agree soon. Back to you.
All right, thanks very much. And as we told you yesterday, Planned Parenthood filed a federal lawsuit claiming the transfer agreement requirement that could shut down the clinic is unconstitutional. The location remains open, though, as that case proceeds.